How Quality Documentation Can Impact Reimbursement by Benjamin Krupp. Health information management professionals are beginning to recognize the link between quality documentation and better quality care, as well as improved reimbursement rates for health insurance services. As the health industry moves from a quantity to quality model for reimbursement, CDI can help validate the quality of care provided as well as optimizing claims processing, as I show in the following slide. So what are we talking about when we say quality documentation? I'd like to use the definition provided by the American Health Information Management Association as having 7 components to quality documentation. It must be legible, reliable, precise, complete, consistent, clear, and timely. So the Centers for Medicare and Medicaid Services are a good place to start for guidance on quality documentation. They've provided 10 conditions for medical record keeping that must be met in order to receive reimbursement from CMS for patient medical claims. These are called the Conditions for Participation, or COPs, and they're laid out in the CMS Guideline Manual, which I've cited at the bottom of the page. So let's look at these 10 COPs. A hospital must have a medical records service that has administrative responsibility for medical records. The organization of the medical records service must be appropriate to the scope and complexity of the services performed. The hospital must maintain a medical record for each inpatient and outpatient. Medical records must be retained in their original or legally reproduced form for a period of at least 5 years. A hospital must have a system of coding and indexing medical records. The hospital must have a procedure for ensuring the confidentiality of patient records. The medical record must contain information to justify admission and continued hospitalization, support the diagnosis, and describe the patient's progress and response to medications and services. All patient medical entries must be legible, complete, dated, timed, and authenticated in written or electronic form by the person responsible for providing or evaluating the service provided. All orders, including verbal orders, must be dated, timed, and authenticated promptly by the ordering practitioner. All records must document medical history and physical examination, admitting diagnoses, results of all consultations, complications, hospital-acquired infections, and unfavorable reactions to drugs. Content forms, practitioner's orders, provider's reports, discharge summary with outcome, and final diagnosis within 30 days of the discharge. So what does it all mean for your bottom line? Now that we have a better understanding of what quality documentation is and the guidelines that CMS has given us for what quality documentation is, let's look at how quality documentation can actually affect a provider's reimbursement and quality of care. Quality documentation can lead to increased reimbursement. An article published by the Journal of HEMA in December in 2016 stated that failure to document properly can subject the patient to being overcharged or not covered for treatment, categorized inaccurately, be placed at higher risk of developing a complication of care, and more likely to be readmitted after discharge. According to Mina Egan, hospitals lose out on millions of dollars a year in denied claims, usually due to poor physician documentation. Having a CDI program can reduce denied claims. The average CDI specialist can bring in an average of $500,000 due to improved documentation. So here, failure to document properly can end up in worse quality of care, lower reimbursement, and then having a program to help documentation can bring in about $500,000 per employee in the CDI program. So what is the role of the health information management professional in supporting physicians? Well, documentation is the answer. Documentation is the legal health record. Health information management professionals assist physicians with clinical documentation. Employing and working with both HIM professionals and CDI specialists is the first step to ensuring any medical practice has the quality documentation that it needs. According to Kate Monica in a 2007 article, having quality clinical documentation will improve communication, increase recognition of comorbid conditions that are responsive to treatment, validate the care that was provided, and show compliance with quality and safety guidelines, all of which has been shown to increase the quality of patient outcomes and improve reimbursement rates. And here's my reference page. Thank you for listening.